Our spine center is a multidisciplinary approach to treating patients with spine problems, so neck and back, things of that nature. And a lot of those patients do respond to non-operative treatments. They don't need surgery. Our approach now is kind of modeled after what a lot of the large academic medical centers do, and it's a multidisciplinary approach where we look at all the clinical information up front. We go through the MRI, the clinic notes, whatever we can get in front of us, and there's a triage nurse that follows a very well-refined protocol. And based on what's the most likely effective treatment first, that's where the patient is initially booked. You have much higher patient satisfaction levels when you have an approach like this, because you're not just running from one separate group to one separate group. We're all coordinated, and so when a patient is seen by that doctor, it's very likely that that doctor is going to be the one that's going to be able to help them. Not seeing this and then, oh, maybe we should go back and try something else over here and try something else over here. You're already at the right person. And on top of that, it's able to cut down wait times, so that patients don't have to wait and see two providers to get to where they want to go. They go to the provider that they need first. And it clears up the schedules of those providers, so that if you have an urgent issue that needs something urgently like surgery, you can get in there very quickly. I mean, we can get someone in with an urgent surgical issue within a matter of days, and even faster if needed. And it also helps with communication with the PCPs. If you got a spine problem and you're not sure, or even if you think you can send it right to the spine center, and we'll take care of that. We'll make sure they get the right treatment. We have physiatry, we have pain management, we have surgery, certainly for broad strokes. I mean, if you have really bad things, spine tumors, or something that cauda equina syndrome, where you start losing function in your legs, or something like that, I mean, those immediately go to the surgeon. Usually they even flag me, so I know to get that in, so we make sure that they get an immediate appointment. Things where people haven't had much workup yet and just have some back pain, those often go to the physiatrist, because if you haven't had an MRI yet, if you haven't had much tried, you probably need some further workup. So patients that show up in the ED with no workup yet but really hurt their back over the weekend, those are like the perfect patient to go into physiatry first. And then certainly people that sometimes it says on the referral wants to try an injection. Well, probably needs to go to the injection doctor first. People in all different stages of the process are welcome to be referred.